Thanks for joining us this week. We unfortunately know that injury and violence is not isolated to any one part of the world. In this special coast-to-coast edition of the Tabletop Conversations, Texas's Kevin Rix is joined by Bekah Thomas, Director of Injury Prevention and Control from the Massachusetts Department of Public Health, and William Hitchcock of the Washington State Department of Health, discuss how they are innovating their work to meet the growing needs and fast-moving changes that injury and violence prevention professionals are facing in today's world. Hey Bekah, hey Will, thanks so much for talking with me. We were discussing just a second ago, kind of a little bit about how our world is now kind of requiring us to innovate in a lot of different ways. I mean, what you're doing in Massachusetts kind of looks really different, I think, than what I'm doing down here in Texas and what Will is doing out in Washington. And I'd be really curious to kind of see how you guys are viewing the use of technology going forward, the need is whether or not we're going to continue to need to innovate, how you guys are applying that in your work. And yeah, I just kind of love to hear your perspective on it.
Yeah, in Massachusetts, we've been thinking about it a lot. It's more and more stuff is moving online. And even at the state health department, because of the pandemic, we had to shift about 40% of our workforce to work from home. And we're moving away from a situation where we didn't even have a telecommuting policy. So figuring out even how our primary staff, our core staff, can access technology, share documents, get access to the VPN, get a laptop, that sort of thing has been really challenging. But I think it's really important and good. I think if you're not innovating, you're stagnating. So keeping up with the times and making sure we're acknowledging, even especially for injury prevention, how the world around us is shifting and how that will change the dynamics of injury are really important, because otherwise we won't be able to strive for zero and really reduce injury burden in our state. What do you think, Will?
Yeah, I agree with all that as well. And, I think one of the things that we've noticed here in Washington State is, it's great to have this option of that innovation with this virtual, online capabilities, but there's also an access issue. So now what do we do if we're trying to move into this virtual world, but the people within these local communities that we're trying to reach don't have access to Wi-Fi or equipment to be able to be able to view an educational video or webinar on how they can be healthy and safe. And so how do we bridge that gap? And that's where some of those new innovations, I think is vital for us to be looking for that and stretching those limits to reach that next level.
I think that's a good point about access too. I think one thing that we're seeing down here in Texas, we obviously have a really large Hispanic population, and not only making them available, but making them multilingual and having those people who appear on camera for us, I think it's been a challenge too, because not only do we have to now first innovate in a lot of our first language in English, but then have to, cultural adaptations and things like that. Have you guys found anything, similar kind of where you are? So I lived in Massachusetts for 2 years. I'm from Rhode Island originally. So New England, yeah, Rhode Island? Okay, we'll talk about that.
Yeah.
Separate conversation. But yeah, anything that's kind of jumped off to you?
Yeah, we have a lot of languages in Massachusetts, and we're making a really big push in FY21 to start to think very specifically about what documents, what materials need to be translated into what languages to make sure that there's that accessibility component. And it's hard because a lot of the times the funding that we use, we can't necessarily we don't have enough of it necessarily to put towards translation or to put towards printing of documents. It goes towards salary. It goes to the core functions that we have. So we're trying to integrate that more. And then we have so many languages in Massachusetts. I think people think language translation and they jump to Spanish, but in Massachusetts, it's much more about Haitian Creole. It's much more about Portuguese. It's about Vietnamese. There's so many languages. So we're having to innovate in thinking about our funding streams too, reaching out to our MCH block grant partners, reaching out to prevention block grants, other funding streams, so that we can leverage people who already have that built into their work, make the case for why injury is important for families, is important for those other populations as well, and how we can start to actually get that funding in place to do the necessary translation to increase access.
Have you found that there's more funding right now, or different funding?
There is more funding, and there's different funding, and there's emergency funding. So we're having to write grants that we didn't have part of our work plan, that we weren't anticipating writing. And it's, it's all really well-intentioned, wonderful things that we have needs around, but sometimes it's a little bit tailored to a general context for the United States, and doesn't give a lot of flexibility for the state to determine what their gaps in programs and services are. So in Massachusetts, we have a lot of state funding for particular topic areas that the feds might also want to be reinforcing. Right now there are grants out for suicide prevention from SAMHSA, the CDC, another one from the CDC, from I can't even think. There's a lot of wonderful suicide prevention opportunities coming out, but unintentional injury still doesn't get very much funding or have very many opportunities.
Yeah, and I think that is a good place where we have to start looking for that next innovation area is how we're funding things, right? We have to find new ways, because we're moving more and more into these areas of systems thinking and shared risk and protective factors, and it really requires us to look at this more global piece and look upstream. But our funding sources, our funding mechanisms aren't really geared towards that. They're very specific, and so we have to start looking at how do we start shifting this idea of how we fund things and how we work on things, so that we can reach these very diverse groups that we have, in many of our states with different languages. And I think, not only, one of the things I'll go back to in talking about the languages in Washington State, one of the things we also look at here is not just the different languages, and we have tons of them too, but it's also about whether they have that understanding. We have lots of people here that speak a language outside of English, but they don't read it and they don't write it. And so what's the language literacy that we have to also address when we're trying to get our messaging across and help people out? So that's another factor that we have to start looking at. What are our tools and resources to be able to help us do that?
And what kind of resources kind of have you guys leaned on for when trying to, either are you redeploying what you currently had and changing what people were doing prior to really spend more time? I mean, for us, we've really kind of shifted a lot of our focus into spending more time learning digital medias and things like that, so we can learn how to put on video production and things that we think we need going forward.
So to address the literacy issues, one of the things that we are working with is having these community advocates. So within these different cultural groups, we find these champions that can come in and be that bridge between the work that we're doing within that particular community, and help us understand the culture and the norms around that, and identify ways that community would best access information that they need. And so that's been very valuable for us, and been a great tool.
Yeah, well, we have a similar thing in Massachusetts too, where we don't necessarily think of ourselves as the people who are providing the frontline information and education. We rely on our partners, like our home visitors, our caseworkers, our shelter staff workers. Even in Massachusetts, we now have formal community health workers. So there's actually a curriculum to go through and credentials to bring more power and authority to a position that's existed for a really long time. So I see our role in accessibility is getting the information into the hands of the people who can really deliver it to the families, to the clients, to the caregivers, who can really have that impact. And we've noticed too, in terms of access and technology, we've noticed that those folks, the home visitors, the CHWs, et cetera, they're using more and more tablets. And there's a couple challenges that come up with that. Hotspots, access to the internet, especially in our rural zones in the western part of the state, even cell phone access is really limited out there. And what I'm hoping we can do in the future is when we're thinking about creating documents that can guide conversations or that can guide these interactions, we can move into more of an app setting where you can click on different things and then have a guided conversation based on the responses so that they don't have to memorize every single little guideline, protocol, and regulation that the department puts out, but rather they have a tool at their fingertips that can help them walk through a conversation with their clients and help their clients make the best decision possible.
Yeah, no, and I totally agree. And I think as we move forward, whether it be apps, whether it be tablet technology, whether it be, I think consistently is getting the information in the right person's hand and having that person be able to easily use that information is something we have to kind of continually think about as we push forward. I just want to thank you guys for being in this conversation with me and kind of, as we move forward with it. We really love the ideas, especially when we start thinking more funding opportunities and things like that. Thanks for watching, and remember to subscribe.